Hi everyone, I'm Josh.
I'm Gabe.
From Balanced Body Rehab. Today Gabe and I want to show you how to untwist your pelvis. Sometimes when you're sitting you might feel that you're distributing your weight a little more on one side, or when you're lying down like Gabe is here, maybe you'll feel like one buttock is on the ground differently than the other, or just in general your back feels tight and you feel twisted up. There's a common position that the pelvis tends to shift into that we use with a lot of our patients, or we've corrected with a lot of our patients to help give them some relief from pain and feel unlocked. And so we're going to show you that today. The technique is called the 7-11. The reason we call it that is because if you think of your pelvis like a clock, and that there's a clock on your pelvis right here facing up towards the ceiling, Gabe's belly button is going to be 12 o'clock. Over here is going to be 3 o'clock. Down here in the groin area is going to be 6 o'clock, and then on the other side is going to be 9 o'clock. So when we're asking him to correct his pelvis, we're going to correct his pelvis to the 11 o'clock towards his right armpit, and towards the 7 o'clock down in this arena there. Okay, because his pelvis typically is twisted like this so that it's facing to the left. So that's the most common presentation. So we're going to correct that. So in order to do that, I'm going to have Gabe grab his right knee and pull it up towards his right armpit, or the 11 o'clock there. And the left knee is going to fall down here, just like this. The purpose of the knee falling down is not to see how far you can get the knee down. Certainly we want it to go in, but the purpose of this is we want the pelvis to rotate and come up here. Just as the pelvis is rotating and coming up, I don't want to see the rib cage right here where his hand is. I don't want to see the rib cage raising up, because we're trying to get dissociation between those two entities. We're trying to get the pelvis to move up and this to stay down, and so there should be a stretch sensation, or we're trying to get a stretch right here in the flank area between his pelvis and the rib cage there. So one of the things we commonly ask people to do is, once they're in this position, use a tool. We have this knobble tool here. You put that in your palm, and then you can rub the area. You rub the area between your ribs and the pelvis. You can feel those two bony landmarks. You just rub in there, and it'll be sore and achy and feel kind of ropey, because typically those muscles are more tight on that side. Okay, if you don't have a special tool like this, certainly you can use a lot of different household items, like the handle of a screwdriver, or in this case the handle of a scissors works really well. Not the sharp end, but the handle to get in there and really rub those areas. Okay, so that can help quite a bit to unlock the system. One of the other ways you can make this stretch more effective is you can do a contract relax with this. And so what Gabe's going to do is, I'm going to ask Gabe to push his knee down into his right hand. You're not going to see him move. He's pushing his knee down into his right hand to create what we call an isometric contraction. He's squeezing his glutes and pushing the knee into his right hand. And then once he gets through with that, now he's going to pull the knee up just a little bit more, and that derotates the pelvis a little more. He's going to push his knee down into his right hand again, hold, and then relax and pull it up some more. And that helps derotate the pelvis further. Gabe, did I miss anything there?
You got it.
All right, if you have any pain with this, of course, stop. But ideally, you should feel the stretch on this side, or maybe a little bit in the lower back. Stop if you get any pain. And also, this is just one component of untwisting your pelvis and spine. We have other videos on our YouTube channel to help correct the rest of your kinetic chain and untwist your spine. So please tune into those. Thank you.